Hi everyone, welcome to CCC Smiles, which is our clinical practice based in Mosman and CBD. This is a video where I'd like to walk you through what it's like to have orthodontic treatment with us and what can be achieved in many cases nowadays without braces. So I'm going to go through a few little things about our practice, show you some cases and talk about what it's going to be like for you. So our practice is based in Mosman and Sydney CBD. I have been an orthodontist for several years now and been in a dental industry for over 20 years with lots of experience when it comes to orthodontics. I am an Invisalign diamond provider. What that means is that I treat a lot of cases with clear aligners. And I'm quite experienced for the last few years in doing anywhere from simple to complex cases. So rest assured you're in best hands. Just a little bit about me. I'm an orthodontist. I have finished my dentistry in Sydney University in 2001. After that, I went on to do another degree in clinical research at Sydney University, following which in 2013 I graduated as a specialist orthodontist from the University of Adelaide. Following that, in 2019, I completed my Master's in Business Administration, and I've also done an amazing design thinking boot camp at Stanford University, one of the world's best universities when it comes to innovation and digital disruption. So overall, you are in the best hands of a highly qualified orthodontist, as well as someone who loves pushing the boundaries when it comes to adopting new technologies to make sure that your treatments are delivered in the most predictable way, in the most efficient way, and that we get the desired result for you with least discomfort. So what does that mean? Well, all of this is in my book, Love is All You Need and a Good Orthodontist. You would have received a link to download this. If you haven't, jump on our website and it's all in there as well. I would like to share a little welcome video with you before we launch into your treatment specifics. So please watch on and I'll see you soon.
Hi, I'm Vandana. I'm the orthodontist you see at CCC Smiles, and I'd like to tell you a little bit about what we do. At CCC Smiles, we believe in getting you the smile that you've always desired, as comfortably as possible, as easily as possible, and as suited for your lifestyle as possible. The North Shore vibe is all about fitting in with your active lifestyle. The North Shore people, what do they love doing? They love surfing, they love the beaches, they love eating out. The beauty of straightening your teeth and getting that smile in present times is that you can still do all those things without any discomfort. Invisible braces are the new irresistible. They're not just for adults as you may think, but they're also now suited for kids and teens of any ages. We don't have to put braces on to straighten teeth nowadays. They can be done comfortably with Invisalign or clear aligners. The technology has come so far that we get precise results faster, better, and with way more comfort to suit your lifestyle. The beauty of straightening teeth nowadays is also that you can eat, drink, do whatever you want, live your life. I love Mosman and I love having CCC Smiles in Mosman. One of the reasons I created this practice was to make you feel homely and welcome. From the time you walk in, this place is a home. It's not a dental surgery, and that's the feeling I want to give all my patients. To create that winning smile, see your orthodontist at CCC Smiles today.
So what is Invisalign? Invisalign are a series of clear aligners. So we have this model here. We have these trays. These trays are specifically designed to straighten your teeth in a sequence. And being highly digital and customized, they tend to be quite predictable, especially if you wear them well. So I'm going to talk a little bit about that. Why do we do so much clear aligners? Well, there's a lot of research now coming and showing how much more amazing it is as compared to braces. So let's look at the differences. So firstly, both braces and clear aligners are effective in a variety of cases, including yours. What they're also good at is actually getting there predictably. So we have similar results. What we love about clear aligners, they're nearly invisible, right? So you cannot see them. They're also removable, which makes them really hygienic, and you're able to have the freedom of eating whatever food you want without much emergencies. So overall, your treatment does not have a lot of extra unnecessary appointments. Your oral hygiene is quite well maintained, and you can bite into apples if you want. What about brushing and flossing? You continue that as normally. There's no change required. What about the cost? Well, the cost is actually the same in our practice when it comes to different appliances. The wonderful news is you're not going to have as many emergencies, right? Your orthodontic visits aren't as frequent because we use virtual 3D tracking every week for you, and I'm going to explain that a little bit later. What about treatment time? I know you all want to finish fast, right? So the good news is that we've got a couple of good clinical studies that now show clear aligners often finish faster than braces in majority of cases, and especially in our practice, because we use them a lot and we're highly experienced with all the right technologies around this, we are definitely finishing about 25% faster with Invisalign clear aligners than with braces. So let's talk about treatment length. Treatment lengths generally vary. A very simple case could be 6 months, whereas when we need to change bites or midlines or make, the best possible, it could be 12 to 18 months. When it's an extraction case with severe crowding, this could take up to 2 to 3 years. So it really varies based on your photographs you've submitted to us. What about aligner wear time? You do have to wear them 20 to 22 hours a day. You remove them for eating and brushing. And of course, if you're going out for a very important event, like a public speaking event or a dinner party, you can have them off for 2 or 3 hours a day with no hesitation. What does Invisalign need? Well, we often need something called attachments. Attachments are the little white blobs you see on the sides of some of these teeth. They're not put on every tooth, only some teeth. And we really don't know which ones we're going to put them on until we really bring you in our office and do a scan of your teeth. But these attachments are little tiny white things that are quite invisible. They're not painful. They are quite soft and rounded. And we try to make them as invisible as possible for you. But they are needed on certain teeth, and most people cope with them really well. What else is needed? Sometimes we might need something called interproximal reduction, or IPR. IPR is a very safe and effective procedure that helps to align crowded teeth. What we do is go with a really thin, flexible type of file that doesn't really cause much pain, doesn't cause much damage. It's, as I said, very safe, gentle, and effective. And it helps to relieve the crowding somewhat. So be assured that this is not a huge procedure. This may be recommended for you, maybe not. We will have to really be specific here once we see you in our office. Now, I would also like to take a moment to explain rubber bands. Sometimes rubber bands are needed on the sides of your teeth to shift teeth faster or to get your bite in the right position. And we have somebody showing you how to wear the aligners and rubber band in this video. So I'd like to share that with you.
How are you?
I'm pretty good.
So Josh is wearing his Invisalign teen aligners. He's on number
14.
14. And he's going to demonstrate how easy it is to put them on, take them off, and wear rubber bands.
Okay, so you get your bottom aligner or top. You want to put it on the bottom with the bottom.
Sorry,
aligner.
we're going to zoom in a bit here just to have a look.
And all you need to do and just stick it in like that. Get the other one. You just put a little pressure on it and it's all good.
And can you demonstrate your rubber band wearing skills today?
Yeah.
So Josh is supposed to be wearing rubber bands all the time.
You get 2 rubber bands. They're very small, as you can see. And you just get it on top of your hook that's on your Invisalign. Get it around it. You pull it down onto the attachment.
Wow, that was quick.
Yeah, it's really easy.
Another amazing thing about doing clear aligners is you will receive a movie of your treatment plan. So once I have approved it, you get a movie like this showing you the changes that will be happening week by week. And often if you wear them really well and they've been treatment planned by me, we would say about 80 to 90% of the movements here will happen. Okay, so you have a kind of an estimation of what your teeth are going to look like by the end of the treatment. So this is a typical movie you're going to receive, and you have access to all your movies that we build repeatedly. Another amazing thing about our practice and my treatment philosophy is that I like to make things as convenient as possible for our patients and as effective and as efficient for our patients. So a very new technology called dental monitoring has arrived on the market in the last 5 years. We're one of the world leaders in using this technology and have published some of the first few clinical papers on it. So what this is you are going to take a video selfie with these blue retractors as you see. So these little blue retractors are given to you, and you will be taking a video of your teeth with this. The video looks somewhat like that, and you will upload this every week to us, okay, using the app Dental Monitoring. Now what we can see here is that which teeth are moving well, which aren't moving well. As you can see, the upper left canine here, the tooth right there, is not tracking well. So we will message you to say, hey, something's not going well. Either you should not change your Invisalign aligner or come in and see us. So we're tracking you week by week, and it really makes sense, right? Within your phone, you will have a video like this that will actually show you your before and after changes, which is phenomenal. Everybody loves these kind of videos, and it kind of really highlights where you've come so far. So this is all the power of 3D virtual tracking. So if we were to only use Invisalign, we often find treatments go longer and less predictably. When we combine Invisalign with 3D monitoring and virtual tracking via your smartphone, we reduce 30% of your appointments and we get there 20% faster. This is by clinical research that we have published in the top orthodontic journal. So now let's look at what can be achieved, because you are here to get straight teeth, white teeth and straight teeth. So let's talk about a narrow smile. This lady had a narrow smile and uneven heights of her upper teeth, and simply within 6 months we were able to actually not only relieve the crowding but appropriately place the teeth that looked really pleasing for her smile. And of course, that expansion you see in the photo below, you can see how we've managed to even expand the narrow jaw. This is another lady in her mid-30s where she had really narrow teeth and also uneven teeth and crowding. And you can see that this is about 12 months in treatment, and we were able to finish her smile quite nicely. This is another lady who only took 6 months in treatment. Again, a very narrow, crooked smile. Upper teeth are kind of in and out, up and down, and needed a bit of symmetrical form. Okay, these results show you the high precision we can achieve with aligners that is often quite hard to do with braces. Now this is also an adult case which had more crowding on the lower teeth. You can even see midlines are shifted. So this took about 15 to 18 months, but while we were doing the treatment with the clear aligners, we also did whitening for this patient. So you see whiter and brighter teeth at the end, and really well aligned expansion and arches. Okay, so this is another case where we were able to finish quite well in about 15 months. Now what you see here is again those white blobs on the side, which are attachments. This is another case, a male in his 60s who never liked the lower teeth that were very crooked. His upper teeth were quite good, but we lined up his lower teeth, we did whitening for him, and this took about 9 months to straighten out. This is another lady in her mid-20s who had something called an open bite. This took about 12 months in treatment with clear aligners, and what we did was close the bites so the patient could have improved function and a better smile at the end of it. Let's look at another case. This is a case of severe crowding and a lot of protruding incisors. So you can see the front teeth are really crooked, rotated, and protruding. The patient was diagnosed for having 4 teeth out, but we actually managed to fit everything in without removing teeth, creating a pleasant smile, using a lot of that IPR that I just talked about. So we did filing between the teeth, which is quite safe, quite gentle, quite effective, and we were able to line all her teeth. This took about 18 months in treatment and a very happy patient at the end of it. This is a teenager we treat, and we love doing clear aligners for children and teenagers. They work amazingly well. So this teenager had very crooked teeth and a really traumatic bite that was not healthy for him. The entire treatment took 15 months, and we were able to achieve a very amazing and beautiful result for him, very fast, with no emergencies, and a very comfortable patient throughout the treatment. This is another teenager who came to us, and one of her canine was not erupting. So we had to actually erupt it down into the arch, and this is again done with Invisalign, and you can see the progress of this teenager. We're able to finish with a beautiful result, and this took about 2 years. This is a case, an 8-year-old girl who had a reverse bite or an underbite, and we needed to treat her fairly fast, and we decided to use Invisalign rather than braces or any plates because children simply love Invisalign. It is so easy for them. They can play sport with it, it's comfortable, they can speak with it like normally. So within 3 months we were able to correct her underbite using clear aligners. This is a child again at the age of 9. She came with the lower jaw really back. Traditionally, we would give children like these big, thick, bulky plates or braces to fix the lower jaw position. And what you see here is what we did was Invisalign with rubber bands, and it really helped bring the lower jaw forward and allow normal growth and development to take place. So this took about 12 months of treatment with a simple clear plastic tray. So as you can see, a lot can be achieved with Invisalign, from really young children to actually older adults, from simple cases to severe cases. What you really want to do is choose the right provider, especially an orthodontist who does a lot of Invisalign, like myself, like a diamond provider, meaning that we do a high volume of it and we really understand complexity. Now, before we end this video, I would love to show you a video of a couple who started their treatment together with us. And this couple were so happy within the first 4 weeks of their treatment. They really wanted to share their experience with anyone who's thinking about starting. I think it's a great video to watch. I hope you enjoy it. Let's put it on.
Hi everyone, this is Jackie and Justin. They've both started the Invisalign together and they're going to talk to you about their initial experience. So who's going to go first?
I'll go. So we're a month in, so we're just about to change from aligner 2 to aligner 3. It's great. We're really enjoying it so far. The first 2 days are a little bit sensitive, just while you're learning how to take them out and put them back in. Just getting used to that feeling. A little bit sensitive, but once you pass those 2 days, it's great. You barely notice that they're on. We've both found that it's better having them in than having them out.
Absolutely. Yeah, it's definitely the attachments that I felt was the hardest bit, was the first couple of days, because they were a bit rough on the gums, which is why it's more comfortable to have the liners in. So keep them in.
Doing it together, we've got that constant reminder to each other to always stick them in.
Basically, for me in particular, hanging around with a bunch of blokes, I was quite nervous about getting Invisaligns because I didn't want to feel like I was wearing football mouth guards and was sounding funny to talk. But to be honest, nobody even realised that I was wearing any. I had to tell people that I actually got Invisaligns in order for them to know what I was going through. So you don't notice, you really don't notice that you've got them in. I don't know about you, if anyone knows.
I found the only people that have noticed are people who have actually done the Invisalign journey themselves, and they make a point of saying something to me because they're so excited that I'm on the journey and that they're so happy with their results. So those are the only people who really notice, because I think they're looking out for it, because after their journey they're so happy they look out at other people's teeth. So yeah, it's been great. No one's really said anything. I found it hasn't been a hindrance in day-to-day sort of life. You get used to having your Invisalign container with you, and just part of taking them out, rinsing them out, rinsing your mouth out after you eat and putting them back in. It just becomes part of you every day.
It's a routine.
So it's easy, yeah, and it's going to be totally worth it, we can tell. Do it, guys, if you're thinking about it, it's definitely worth it.
So let's get to the very final stages. Now, once we finish your treatment, something called retainers will be needed. What are retainers? They come in two types, and you're going to have both available to you. And we'll discuss this more when you come in the office appointment. You can have a clear removable tray that you wear every night after you finish treatment, or a bonded wire. A bonded wire is something we recommend quite often, especially for lower teeth, because they tend to become crowded again throughout life. So wearing a retainer is really important for a long time. In fact, you will find that your teeth will always want to go back. So we need to continuously monitor you for years after active treatment. What's also included in your package is not just your retainers, but also whitening. So if you're 16 years and over and you're not pregnant or breastfeeding, we can do whitening for you, which is quite effective, gentle, gradual. So as your teeth are straightening, we're also whitening them, which is just fantastic by the time you get to the end. I also want to go back to the retainer and tell you, not only we give you wires, we also give you backup extra retainers, so that if you're traveling and your wire breaks, you simply wear this clear tray and it stops teeth from moving. We also give you 3D movie of your treatment plan, the dental monitoring, 3D virtual tracking via the app, goodie bag with lots of stuff that you need to make a successful treatment. And we will go through all of that with you when you start treatment. Pricing. Our pricing is a huge range. So it depends on what you want to achieve, what can be achieved, and what kind of retainers you would like at the end of it. So our pricing ranges anywhere from $3,500 to $9,500. On average, most people are looking at around $8,000 mark, or maybe in simpler cases, a little bit less. But look, we cannot tell you exact pricing until you submit your virtual photographs to us via our website. So head on to cccSmiles.com.au, go follow the virtual consultation link, and if you submit your photos, you'll get a bit more exact pricing for you. Now, upfront payments always attract a higher discount. So if you want to pay us upfront, that's great. We can offer you a discount, but we also have pay plans for you. And our preferred pay plan provider will make this very easy for you. We'll send you monthly installments. We don't do this in-house, but we use a third party called DentiCare, and we can send you all this information should you want to get started. Lastly, I hope you've enjoyed this video and you understand how the treatment can be beneficial to you, what can be achieved, what are the steps required from you, And we hope to see you soon in our office and get started. Welcome to CCC Smiles.